Hello again, doctors. I hope all of you are managing well. If you don't know me, this is Dr. Sahar Ali, the founder of PLAB 2 Warriors Groups. I am one of the NHS doctors working in acute medicine. I do provide full course with mind maps and simulated scenarios. I do also provide practical course, SIMMAN, examination, procedure, prescription, with mind maps and simulations on a real SIMMAN and real mannequins as well. In addition to that, I do provide one-to-one mocks with detailed written and verbal feedback. So let's talk about our plan for today. Today we are going to take two approaches, surgery approach and dementia approach. We will take one case from surgery approach and one case from dementia approach. We are going to take the first station with one of you doctors. After that, I will give my comments and the marks based on the GMC criteria. Then we are going to take the map, study the map together of this station. After that, we are going to take the second station. We will do the same as we did in the previous one. And in the middle, I will give you a quick advice about confidence, how to gain your confidence, and what are the tips to, to enhance your confidence. Right? Questions and at the end, please. I will try to answer all of your questions, inshallah, inshallah. So let's get started. Who wants to perform? Dr. Salma Adib. So your exam is approaching, Dr. Salma. Okay, your exam is approaching. Yeah, good. Yeah. So how do you feel? How do you feel about?
I'm trying to feel good.
Okay, don't worry. Everything will be okay, Dr. Salma. Just be confident. Just do your best, and inshallah, we hope to hear good news about your results, inshallah. So, are you ready, Dr. Salma?
Yes.
Okay. Please read the question.
Begin.
Start.
Hello,
Hi.
I'm Salma. I'm the doctor working here. Am I talking to Mr. White?
Yes, doctor. I am Mrs. Sarah White.
Okay, can I say you Sarah?
Yes, Sarah is fine, doctor.
Okay, could you just confirm your age for me?
Yes, I am 78 years old, doctor.
Okay, Sarah. So, nice to meet you.
Thank you.
I understand from my note that you have been admitted because you presented to the hospital because you have fracture of your hip and a surgery was planned for some days. Am I right?
Yes, doctor. They told me that I have fracture in the neck of my femur, the left one, and they are
Yeah.
planning to do a surgery to replace the joint.
Okay. So before I talking about the surgery itself, can I ask you some questions to have better understanding?
Yes, of course, doctor.
So tell me what happened, why you are doing this surgery.
Yeah. Actually, doctor, I was going to the toilet, and it was slippery a little bit, so I slipped over, and yeah, I fell down.
Okay.
Yeah.
And when did this happen?
Like yesterday.
Yesterday.
Yeah.
So before, did you lose your consciousness?
Excuse me.
Did you lose your consciousness after the fall?
No, doctor.
Okay. Is there anyone with you when you fall down?
No, doctor. I was alone, and I tried to call the ambulance, and they came.
Oh, okay. So before that, everything was okay?
Yes.
Okay. So after you came to the hospital, what happened?
The ambulance came and brought me to the hospital.
Yes. Is there any investigation has been done?
Yes, doctor. They have done X-ray on my leg and my hip, and they told me that I have fracture in my femur.
Okay. I'm sorry to hear about that. We got some questions regarding your general health. So, do you have any medical conditions?
No, doctor.
And are you taking any medicine?
No.
Okay. And some questions regarding your personal habits.
Okay.
Do you smoke?
Yeah.
How many cigarettes per day?
Excuse me.
How many cigarettes per day?
I don't smoke, doctor.
Okay. And do you drink alcohol?
No, doctor.
Okay. And some questions regarding your social life.
Okay.
Where do you live?
I'm living alone, doctor.
Okay. And what do you do for a living?
I'm retired.
Okay. And are you managing to doing your daily activity?
Yes, doctor. I was doing everything to myself, and I was totally independent. But after this
Okay.
fall, I don't know how I go to manage.
Yes, I can say this is something you are worried about, but I will help about that and I will do my best to feel comfortable, okay?
Okay, doctor.
So, do you have any particular concern to share with me regarding today?
Yes, doctor. So what will happen after the surgery?
Yes, I want to do after a while. And do you have anything particular expected from us today?
And nothing specific, doctor.
Okay. Okay, Sarah. So, thank you for answering all my questions very patiently.
Yeah.
And for now, I will explain to you what will happen. Okay?
Okay, doctor.
So you are going through the surgery. We need to run some investigation before the surgery to make sure that everything is okay. And,
Yes, doctor. They told me about this. They
yes,
told me.
I saw that in my notes.
Yeah.
So after the surgery, you will be when the surgery is finished, you will be closely monitored in a recovery room, which we will keep close eye on you to check if everything is okay. And you will take some time to recover from the anesthesia.
Okay.
You may have some drowsiness or some nausea. It's fine. It's some of the complication of the anesthesia will take some time and will stop.
Yeah. So is there any complications from this surgery, doctor?
Yes, I will talk about the complication. So there is some complication. There is a long-term complication and short-term ones. So the short-term ones are infection, maybe wound, problem in the wound bleeding, and the long-term complication, it may take like a lot of time to recover because it's some sort of major operation.
Yes, doctor. So is that any possibility to have clot after the surgery?
It depends on BMI of you and some risk factors. So for now, I will check your BMI, which is the ratio between your height and weight. But other than that, I need to ask you, is there any family history of clots or something like that in the family?
No, doctor, but I am really concerned about this because my friend had a clot after a surgery and she passed away. So I'm really concerned about this.
I'm certain of that.
Yeah.
Actually, from what you have told me, your risk of developing plaque is very low. Actually, no risk, but after the surgery, it's advisable to move. So there will be a physiotherapist after the surgery. He will come and try to mobilize you. So, and also we will give you some medication to decrease the possibility of getting any plaque. What do you think about that?
Okay, okay, doctor. Yeah, okay.
And also regarding managing your daily activity after complete recovery, so we will refer you to the occupational therapist. He may visit your home and do some arrangements and modification so that the home is will be fitting in your case.
Okay.
And in some cases, you need to use crutches sometime until some recovery has been done.
Okay, time is done. Okay.
Okay.
Thank you,
Thank
Dr.
you.
Salma. Thank you so
Thank
much.
you.
I feel like there is a noise around you. I'm not sure. I was
Yes, I'm
struggling
sorry
to.
about that.
No
Yes, I'm
worries.
sorry about
It's fine. I was just struggling to hear you, but I managed, alhamdulillah. So yeah.
Alhamdulillah.
So I just, if you don't mind, I will mute you, and then I will talk about the
I
marks.
muted myself already.
Okay,
Go
no
on.
worries. Yeah, okay. Before you mute yourself, how do you feel about your performance?
I think I missed some questions, but I'm trying to cover it. So it may
Yeah.
be some sort of disorganized, but I'm trying to like time before I ask and things like that.
Okay, okay. Yeah. So yeah, okay. Thank you so much. So let's talk about your marks, what you missed, and what should be done, and then we are going to talk about the map. So let me give you the marks quickly. So in history taking, Dr. Salma, I'm a bit concerned about your data gathering. Why? Um, let me stop that. Yeah. Why? You lost the issue a little bit. The issue of this station is to talk with the patient about the post-operative management and to address her concerns. Okay. She is already in the hospital. She is already medically managed, and also she's going to have a surgery. So she has been seen by other doctors. So you don't need to dwell on history taking, what happened, you lost your consciousness, what else about personal history, and these things like smoking, alcohol. It will not help you by any mean in your management or in your task. So please skip them. So I would give you in data gathering like 2. Okay. If the examiner is a little bit strict, he might give you 1. All right. But I will give you 2. In the management skills, you answered all of my questions, maybe because you took a long time in history taking, so you would have more time to talk more about the concerns and the post-operative management, but you answered my questions, and you addressed my concerns, and also you addressed the physiotherapist and the occupational therapist part, because she's living alone and she is 78 years old. So I would give you 3. Okay. In interpersonal skills, you don't have a big problem in interpersonal skills. You were like interactive. You are trying to address my concerns. So I would give you 3 in interpersonal skills. In this station, the skills area, you have a problem in the issue. Okay. in the time management, you spend time on less important points. What else? You didn't examine me, I think. All right? Yeah, as far as I remember.
Yes, yes.
Yeah. Okay. So yeah. So it is fine. But with, after knowing what is the issue behind surgery stations, inshallah you will do better. Okay. If the passing score is more than 7 in this station, so maybe there is a possibility to be in at risk. So just know what is the reason behind these stations, and know what is the important things in your data gathering, and overall you did well, Dr. Salma. You have time to work on how to select your questions. This is the only thing that I can advise you. But regarding your interpersonal skills, you don't have a major problem in interpersonal skills, in the management as well. You touched on almost all of the concerns, and this is a good thing. All right? So keep it up and keep up the good work,
Thank you,
Dr.
doctor.
Salma. Okay, thank you so much.
I want to ask some
Mhm.
question
Yeah.
regarding the data gathering. You told me that it's not important, but actually, I like take some time in that because she may have diabetes, she may have, she may smoke, so this affects the recovery and the possibility of witnessing more infection. So that's why I'm asking about that. But
Yeah.
correct me if I was wrong.
I got you, Doctor. I got you, Doctor Salma. But in this station, I will read the question with you, and then you will know what is the task and how to read your question carefully. How to know what is the task, so you can manage your history taking based on the task. Don't worry about that. All right, I got your question. So let's talk about the question and the map, and then you will know what is my rationale behind this. Okay. And also, what is the rationale of the GMC? So when I talk about the stations and also the markings, it is all of them based on the GMC marking criteria. All right. So let's talk about the question. So, who are you? You are FY2 in the orthopedic department. Who is the patient? Mrs. Sarah White or Mrs. White, aged 78. She's old patient. Presented to the hospital due to fracture of neck of femur. She has been planned to have hemiarthroplasty. So she's in the hospital, and she's going to have a surgery on her femur. No additional information. Your task: please talk to the patient. Discuss about post-operative management. So this is your task. Discuss about post-operative management and complications. Discuss about management once patient has got discharged, and address her concerns. This is your task. If you failed to do most of these points, you will fail the station. Okay? So your task is talking about the post-operative management, the complications, and also what is the management once the patient has got discharged, regarding the safety at home, regarding involvement of the physiotherapist and occupational therapist, regarding providing her with crutch, regarding providing her with carers because she's living alone. You should touch on all of these. All right? Then address her concerns. She will have some concerns like blood clot. She is concerned about blood clot, so you will address her concerns regarding this. Note: anesthetist has explained pain management. Okay, and for your knowledge, doctors, anesthesia doctors will assess the patient regarding the anesthesia, regarding the fitness to the surgery. All right, so it has been done, and they told you this in the question. All right, the consultant has explained the procedure to the patient, so you don't need to explain the procedure to the patient. Okay, they give you this information to guide you, to tell you, doctor, please don't dwell on history taking of the anesthesia things. Don't talk about the pain management. Tell her that anesthesia doctor has explained to you this. And also my consultant, I can see that the consultant explained the procedure to you. All right? What is your data gathering here? So let's talk about the map quickly. You will introduce yourself and greet the patient. The patient is already in the hospital, so you will tell her, can you recap what happened quickly? She will tell you, doctor, I fell down and I have this and this and this, and they told me that I have fractured femur and they plan to do a surgery for me. So you will tell her, I'm really sorry for this. It must be a difficult time. Acknowledge that it is difficult for her. It must not be not easy for you. I'm really sorry for this. And then tell her, okay, how is the hospital stay so far? Is everything all right? I can see that the anesthesia doctor talked with you about the pain management and the surgery. Also, the consultant talked with you about the surgery. Is that right? Yes, doctor. Use the information in the question, all right? Then you will tell her, so do you have any concerns, any problem at all now? So sometimes she will start her concern, like telling about the clot. I am concerned about the clot, doctor. Sometimes she will tell you, doctor, I want to know about the post-operative, or what will happen after the surgery. All right? If you would like to start like Dr. Salma started, it's fine. Tell her, okay, can I ask you few questions about your general health and I will address all of your concerns. So it's based on your way, it's fine. But what is your data gathering here? If you are not going to ask her concerns from the start, so you just tell her, how are you, how is your general health? Is everything all right? Do you have any medical conditions? Are you taking any medications, including over the counter? No, doctor, or yes, doctor. Okay, you don't need to ask about personal. It's not the issue. You will move on to the psychosocial part. Who do you live with? What is your home condition? Do you live in a bungalow or in a house? Do you have any concerns regarding your safety at home? Okay, so this is your task. All right, this is if you would like to start as Dr. Salma started. If you would like to start by asking the concerns, do you have any concerns so far? She will tell you, doctor, I am concerned about blood clot. So you will take your history based on the blood clot. Can I ask you why you are concerned about blood clot? Yes, doctor, my friend has passed away because of this. Tell her, I'm really sorry for your loss. So I just need to ask you a few questions to check if you have any high risk of having blood clot. You know, this is a major surgery. One of the complications of this surgery is having a blood clot. Just few questions and then I will address this concern. So do you have any shortness of breath now? Do you have any chest pain? Do you have any leg pain? Have you had any blood clots before? Do you have any medical conditions? Any blood thinners that you are on? Any family history of previous clots? Okay, do you take any hormone replacement therapy? All right. Then you will move on to the psychosocial part. Okay, so it's based on the way that you want to start the station. I can't tell you, doctor, you need to start like this, you need to start like this. It's based, you are unique, you are a doctor, so start the station by whatever way you want. Okay, but make sure when you talk to the patient to take the relevant history, okay, and to address her concerns. This is your task in all of the surgery stations. Read your question carefully, read your task carefully, take your history taking based on your task. Okay? All right. Then you will examine the patient quickly. I would like to examine you, check your observations, check your body mass index if you would like to mention, and examine the chest and leg, because her concern is the blood clot. Okay, so this is based on the question. This is your history taking. Okay, all right, then you will move on to the management part. I just need to yeah, okay. So the management part, you will try to find out what um, are her ideas about her condition. If she didn't tell you from the start, that they told me that I have fractured femur, and they are planning to do a surgery for me. So you will ask her, how much do you know about your condition? She will tell you, doctor, blah 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 blah. All right. Then, if she is concerned about the clot from the start, tell her, okay, so do you know what is clot? Her ideas about the clot. Yes, doctor, I know what is clot. It's, when you have collection in the blood, and also it can go to the lung. It may be life-threatening. Okay, so tell her it is right. So regarding the clotting formation, it is one of the complications of the surgery. As you know, this is one of the major surgeries. Okay, but we do our best to try to minimize this risk. Would you like to hear about our precautions? Yes, doctor, please. So before the surgery, we will start you on a blood thinner, and we will continue giving you this blood thinner after the surgery for a while. All right, is that okay with you? Yes, doctor. The other thing is, after the surgery, we will involve the physiotherapist. The physiotherapist will encourage you to move after the surgery to prevent any stagnation of the blood, because when you sit down or lie down for a long time, the blood will be stagnant on your vessels, and the clotting formation will be high at that time. So we encourage the patients to move around to avoid any blood clots. Okay, am I clear so far, Mrs. Blah blah blah? Yes, doctor. Okay, the last thing, we can also provide you with elastic stocking to help the circulation in your legs, so to minimize also clotting formation. You don't need to dwell on this. You don't need to do all of these or to mention all of these. It's based on your time management. So just touch on the points. So we will start by giving you the blood thinners. After that, we will continue giving you this blood thinner. We will provide you with elastic stocking. What else, doctors? The physiotherapist will help you to move after the surgery. All right. Do you have any other concerns, Mrs. Blah blah blah? Yes, doctor. I am concerned about the post-operative management, or what will happen after the surgery. Dr. Salma has answered this question in a very good way. Tell her, okay, you will go to the recovery room. There they will look after you. They will check your blood pressure. They will monitor you, and when you gain your consciousness, you can be transferred to the ward there. Okay, do you have any other questions, any other concerns? Yes, doctor. So these are her concerns. It is not necessary to ask all of these questions. Okay, sometimes she will ask like 3 questions or 4. Sometimes if you finished the station early, she will ask you all of these questions. Okay, so let's answer the questions. If she is concerned about the complications, you will tell her, okay, Mrs. X, so there are some complications that may happen. As you know, this is a major surgery. Like any surgery, there are some complications that may happen. if you would like to do it like Dr. Salma did, long term or short term, it's fine. If you would like to take it system by system, like complications in the lung, complications in the heart, complication in the wound itself, also it is fine, based on your way. Okay, and this is a picture of the possible complications, so you can take 2 or 3 of them. The common or the most common complications: pain, infection, and bleeding. Okay, add to this, if it's a major surgery like this, clotting formation. Okay, blood clot or lung clot. All right, so these are the most common complications that you can talk about. How to tell her? Okay, so one of these complications is pain. After the surgery, you might have pain, and I believe that my colleague or the anesthesia doctor has talked with you about the pain management. Is that right? Yes, doctor. The other complication is bleeding, but we make sure that we provide ourselves, or we arrange for the blood from the blood bank, so we prepared for anything. Do you have any problem in receiving blood, Mrs. blah 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 blah? No, doctor. So it's fine, it's okay. The other complications are in the wound itself. Maybe there is delayed wound, maybe there is an infection, so we will provide you with leaflets to read more how to look after your wound after the surgery. Are we in the same page? Yes, doctor. Okay. Do you have any other concerns? Yes, doctor. When should I walk after the surgery? Tell her, okay, as I mentioned, the physiotherapist will encourage you to walk, and we will provide you with a crutch or walking stick just to help you in walking. When to go home? Tell her, okay, so this is based on if you are fit medically, and also it is a decision for the physiotherapist and the occupational therapist. If you are fit to go home medically, and also from the physiotherapist point of view, you can go home. Most probably, or maybe, or not maybe, most probably, like after 5 or 6 days or a week. Okay, so don't give a sharp answer. Okay, always say most probably, and these things. Okay, the other question: when start normal life? Tell her, okay, so regarding this question, most of the people can recover, or we can say you can start the normal life after 6 weeks. Okay, you can gain everything after 6 weeks, like going shopping, like doing the normal activity. All right, Mrs. X? Yes, doctor. Regarding her home concerns, so you will tell her regarding because you are living alone, we will provide you with carers to help you after the surgery. All right, so is it applicable, or do you have any questions regarding this? No, doctor, it's fine. Okay. And regarding your home safety, as I mentioned, the physiotherapist will make sure, and the occupational therapist will make sure that your home condition is safe enough to go to your home. All right, Mrs. X? Yes, doctor. So do you agree on this? Do you have any other questions, any other concerns? No, doctor. Okay, I have answered all of the questions, doctor. As I told you, it's based on your time management. It's based on your time management. So, any surgery station, please read your question carefully. Know what is your task to take your history taking based on this. Okay? And please, the patient will have concerns. Answer her concerns. Okay? So not all of the surgery stations you will explain the surgery. Not in all of the surgery stations you will talk about the pre-operative management. Not in all of the surgery stations you will talk about post-operative management. So it is based on the concerns of the patient and your task. Alright? I hope it is clear now, doctors. We have, I think, 5 or 6 stations, surgery stations: hip replacement, ovarian cystectomy, I think, dermoid cyst, okay, also cholecystectomy, laparoscopic cholecystectomy, herniorrhaphy, and screw removal. 5 stations. In all of these 5 stations, read your task carefully, know what is your task, and take your history based on this. If your task is pre-operative assessment, so you need to assess the patient for fitness of the surgery. Medical conditions, medications, what else? Psychosocial as well. Examine the patient, okay? Anesthesia, if they didn't provide you in the question that the anesthesia has been done, the anesthesia assessment, okay? If it's talking about post-operative management, you will find out what is the task exactly, okay? Is it about going home? Is it about the post-operative management itself, like in the hospital, okay? So please read your task carefully. Did you get my point, doctors? Did you get the point, Dr. Salma?
Yes, doctor.
Okay. So are you convinced now?
Yes.
Okay, good. So yeah, this is regarding surgery stations. All right. So I will talk quickly about how to gain your confidence. Okay, then we are going to take the second station. Okay, I will play a video from my course. It is about the confidence, how to gain your confidence, how to be confident, what are the tips in your practice and in the exam, inshallah, quickly, and then we are going to take the second station.
Our advice for today is about confidence. What is confidence and how to gain and build up your confidence? First of all, what is confidence? It is the belief that you are valuable, worthwhile, and capable. In another meaning, your self-esteem. This confidence will turn thoughts into actions. So if you have the confidence, you will move from thinking about I want to practice to I am practicing now. So you took the action to practice, and also you took the action to practice in front of people. If you have this confidence in your mind and inside yourself, you will do the actions. Okay? So please have the confidence. It comes from your inside, how you think about and respond to challenges, how to deal with uncertainty. In some points in the exam, you will find yourself that I get stuck in this point. I feel like this situation is uncertain. So if you have enough confidence, you will deal with this uncertainty very smoothly. Okay? Confidence is a skill, and it can be developed like the muscles. So please grow up your confidence. How to grow up your confidence? By
practicing. Practice, practice, and practice. It is like a circle. When you practice, you will gain your confidence. Your confidence will make you continue on your practicing. Practice, confidence, and so on. Okay? And I always say, fake it until you make it. Fake that you are confident until you will be a confident doctor, a real confident doctor. Many people say, I will be confident when I'll speak better. Okay, so how you will speak better then? Again, by practicing. So please practice and build up your confidence with practicing. So there is a question here. What if you practiced a lot, but unfortunately you failed? So this means that you were practicing in the wrong way, in the wrong direction. Okay? So you should redirect yourself. And that's why it is very important to know what PLAB 2 is about. Before you start your studying, before you start your practicing, it is very, very important to know what is PLAB 2, what is expected from you, what are they looking for, what are the marking criteria, what are the questions, how they come. It's very, very important. And that's why the first thing in my YouTube channel is a video about what is PLAB 2. Also in my course, I have an introductory folder about what is PLAB 2, what are the marking criteria, what should you do, what is the exam, what is expected from you, how to deal with the patient. It is very, very important to know all of these before you start practicing, before you make your mistakes, and at that time it will be like a habit, okay, and it will be very difficult to get rid of them, of the mistakes. Alright? If you are a repeater, is this the end of the world? No, at all. Okay? Actually, anyone who is repeater now with us is lucky. Yes, lucky. Why? Because you have now the experience of the exam, and you have great knowledge. You just have, misunderstanding of few points. Okay? Just you want to redirect yourself to the right way. This is the only thing. So please, don't be ashamed that you are a repeater. Okay? Stand up again. Restart again. This is not the end of the game. Okay? I was one of the repeaters. So take this as an inspiration for you. I am now teaching you. So please, don't be ashamed. And never ever lose your confidence and your trust in yourself. Please, doctors. And believe me, inshallah, in the next time, you will pass with very high marks, inshallah. Okay? So, if you are a beginner, you need to build up your confidence. If you are a repeater, you need to keep your confidence and to make sure that you are still on the right track. Okay? I will give you now some tips on how to build up or to keep your confidence. The first one is being familiar with the questions, how they come, and what should you do in each question. And that is what I do in my course. I read the question, I give you what are the important points, I give you what are the cores of this station and what should you touch on. We talk about the interpersonal skills part. We talk about the management part. We talk about history taking part in each station. Okay? The second tip is believing that you have your own identity, your voice, your own phrases, your own sentences. You are unique. Everybody is unique. Yes, you can learn phrases and sentences from other doctors, but you still will do these phrases by your way because you are unique. Okay? The third tip, as I mentioned, please accept who you are. If you are a beginner, accept that you are a beginner and you need to build up your confidence and start practicing, please. If you are a repeater, accept that you are a repeater and you were in the wrong direction. Accept that and restart again and redirect yourself. Alright? The last tip is, please avoid comparing yourself with others. Don't say, I will never be like this doctor. He has very, very, very high interpersonal skills and I'm not going to be like him. So it is wrong, doctors. Please focus on your uniqueness. Focus on your way. Focus on your practicing and how to build up your skills, how to build the skills of taking history, of giving an advice, of managing the patient, rather than comparing yourself with others. You can compare yourself by yourself after a while. This is the only comparison or the only valid comparison. Okay? Don't try ever to think what others think about you. If you want to practice in front of people, you will have the thoughts that you want, but what will stop you that you are afraid from the doctors when they listen to you, they will judge you, they will criticize you. Don't never ever think about this. Focus on your way, focus on how to gain the skills of confidence, of counseling, of dealing with the patient, of talking, of everything. Take the comments like a step to improve yourself, okay? And when I give you the comment, I try my best to give you a constructive feedback without criticizing you. I just give you what you missed and what should be done in the station. And please, doctors, when you do that, when you give your comments to your colleagues or your study partners, please avoid criticism. Okay, avoid criticism. Always start by the good things that the doctor done, and then talk about the the missed things and how to improve them. Okay, we all learn, we all grow up, so please don't be ashamed and don't be like afraid from others and their comments. No. Okay, we all learn. Alright, so please build up your confidence, build up your skills, practice, practice, and practice. Thank you for listening, and I hope it was helpful, and let's move on.
Okay, doctors.
Doctor, I have a question, possible?
Yes.
Yeah, in post-operative management, like just this scenario, do we need to examine the patient? Any examination for the patient?
Yes, you can examine the patient, doctor. You can examine because his concern is lung clotting. So examine the chest, examine the leg, just to make sure that you didn't miss anything, or you don't miss anything. Yeah.
Right.
Yeah.
No observation, just examination of the lung and limbs.
The chest, the chest and the leg. The chest and the leg.
Okay.
And check the observations, doctor. Who is talking?
Yeah, Dr. Amal.
Okay, Dr. Amal. So always in your examination, you will check the observations and examine local examination. Local examination is based on the station. Here, the patient is concerned about the blood clot. Okay, he is already been assessed by other doctors, so you don't need to assess the patient for fitness of the surgery. Okay, you just check his chest and leg based on his concern, and you will move on.
Right. So not full examination like observation and
Check the observations. Check the observations. We do check the observations of all of the patients every day, Dr. Amin, in the hospital.
yeah,
Yeah.
because it's just post-operative. So what will happen? I thought I have to talk to the patient about what will happen after the surgery.
Yeah.
And when to go home and the possibility of his home to his condition and advice to mobility and so on. So
Yeah.
yeah,
So,
okay.
yeah. Okay. And if you missed the examination and you did everything right, so it will not be a fail. Okay. So a failure of the station is it doesn't depend on only one mistake. Okay. So just focus on how to do the station in a perfect way. Okay, so let's take the second station. Read your question, Dr. Isra. You will have 1.5 minutes, please. Start.
Hello, I'm Dr. Esra, the one of the junior doctors in the neurology. And who am I speaking with?
Yes, doctor, I'm Sarah.
Okay, could you share the full name? Could you share your full name with me, please?
Yes, I'm Sarah Chapman, doctor.
And could you confirm the relationship with Miss Amanda?
Yes, I am her daughter, doctor.
Okay, and how would you like me to call you?
Call me Sarah, it's fine, doctor.
Okay, nice to meet you, Sarah.
Thank you.
So we're here to talk about your mother's condition.
Yes, doctor. I am really concerned about this. That's why I was waiting for your call.
Okay, that's fine. We'll talk about her shortly, but before we do that, can you tell me how much do you understand about your mother's condition?
Yes, doctor. She's having dementia, doctor, for 3 years now, and she's getting worse. In the last 2 weeks, she started to refuse eating. She doesn't want to eat at all. I give her all of the food that she loves, but she doesn't want to eat. She doesn't want to drink. She's losing weight as well, doctor. So I got very worried about her. So I decided to bring her to the hospital.
Yeah, you've done the right thing by bringing your mother here, and I can see that you're very concerned. So we'll try to solve this problem for you. And fortunately, we have done many examinations and tests, and we'll talk about them as well. But I want to understand more about your mother's condition. So you told me that she has dementia for 3 years. How is she affected by dementia?
Oh, doctor, she is totally dependent on me, and I'm doing everything for her.
Okay, I can see that you're a caring daughter. I'm glad to see how caring you are. And are you living alone with your mother?
Yes, I am living alone with her. Yeah.
Okay, and does she have any other problem apart from eating less?
I think this is the main problem nowadays. Yeah.
Okay, does she have any shortness of breath, for example?
No. No, doctor.
Any cough? Any cough or?
No.
Okay, no. Okay, and is she capable of knowing you?
No, doctor. No.
Okay, okay. And you told me that you're living alone, but do you have anyone else, like a carer, coming to your house?
Carers? No, doctor. Nothing like this. Is there any kind of something
Yes,
like
there
that?
are. Yeah. Actually, there are some options, some support systems for people, especially like you and your mother. But we'll talk about them in a short while. I also want to understand, does she have any other condition apart from dementia? Any medical issue?
No, doctor.
Okay. So I would like to examine your mother. I would like to do general physical examination, take her observations, and I would like to perform a neurological examination as well. Sarah, as I've mentioned earlier, we've done a series of investigations, and fortunately, they all came back normal.
Normal.
So, yes, normal.
Oh.
So, do you have any idea about what it might be? What might be causing your mother's eating problem?
No, doctor. So why she's not eating well now?
So she has dementia, and dementia can present with various symptoms. Some of them are like memory problems. You've told me she doesn't know you. You've seen a lot going on with your mother in these 3 years, and actually one of the symptoms of dementia is eating problems and weight loss eventually. So are you following me? Are we on the same track? Yeah. So eating problem is representing the progression of dementia actually, and I can see that you're very caring, and you told me you're doing her favorite meals. But sometimes, even though we try everything, they are not capable of eating because they might forget even how to chew or swallow, or the functions of the proper eating might become weaker.
Yeah. So
2 minutes remaining.
what are you going to do for her, doctor, now?
A team of our team has decided to not to do some aggressive treatments like inserting tubes or doing operation or giving intravenous treatments. Yeah, because as you might understand from what I've told you, these are all aggressive treatments, and unfortunately, our consultant and our health team has decided to give palliative care instead.
Palliative care?
Yes.
What is palliative care, doctor?
So in palliative care, we're trying our best to support her. We're trying our best to feed her with like normal people, but we're taking some precautions. And also I would like to talk you about these precautions. You can do it at home as well, because I can see that you're trying hard to feed her.
Yeah.
So you can.
What I can understand from you, doctor, that she is terminally ill. So will she die, doctor?
I can see that you're concerned about her death. I'm not saying that she's going to die like in a short while or anything like that, but I only can say that aggressive treatment is not
Move on to the next station.
I was so struggling.
Okay, so before I give you the marks, Dr. Isra, how do you feel? What you know?
Well, I wanted to talk about many things,
Uh-huh.
but I ended up talking about, I don't know, some like a little portion of what's on my mind.
All right. So, what do you think in your mind that you can skip in this in the station, or what are the points that you talked a lot about, so you can save your time?
Let me guess. Yeah, in data gathering, I guess I have spoken a bit much, but yes, like I've asked if she's having any shortness of breath or anything like that. I could have, because these investigations are all done, and I could have moved on with the management a bit earlier.
Yeah.
To be able to, yeah, but the thing is, I'm going in details. I'm trying to be too descriptive. That's why probably I'm losing time.
Yeah. Okay. So I just need to highlight a few or one point, doctors, because I feel like you have misunderstanding of being scripted. Okay, so if we have 16 doctors, okay, let's say that we have 16 doctors and we have only one station, and these 16 doctors will do the same station. Okay? So it is normal for the all 16 doctors to ask the questions in the same way. It's fine. Okay, because it is the same question, it is the same station. All right, sometimes some of these 16 doctors will explain the palliative care in the same way. It's totally fine, because this is the same station. All right, being scripted is being asking irrelevant questions and being away from the issue of the station. This is being scripted. Okay?
Yeah.
So please just put in your mind, or bear in mind, that being scripted is being away from the issue of the station, asking irrelevant questions. Okay? And doing irrelevant things to the station. Okay? This is being scripted. This is being scripted. Maybe you have learned this station from one of the notes, and this note explaining the station in a wrong way. So you will do the station as the note explained the station without knowing what is the issue of the station. This is being scripted.
Yes, actually, I'm sorry for interrupting. In the notes of the academies, there are so many things, and in our minds, when we started performing, we have many things, and we are not exactly sure which of them we're not prioritizing properly, I suppose.
Yeah. Okay. So do the station logically as you are in a real life. Okay, so this is being non-scripted. Okay, So let's read I just need to give you the marks before I forget. So in data gathering, you asked most of the questions in the data gathering. You missed asking about wishes or advance directives. This is, you can bring it in the management, but you didn't have time to do this. Okay? You don't need to examine the patient. It is a phone consultation. It is a phone consultation. Please call her.
Okay.
Okay, read your question carefully. All right. So you don't need to examine the patient. The examination has been done. The investigation has been done. Everything is done. So you will tell the relative that we have done this. Use the information in the question.
Okay.
Okay. So in data gathering,
Just
I would
to verbalize.
I would give you 3 or 2 or 3. Okay, 2
Okay.
or 3. In management skills, you didn't. To be honest, you didn't finish all of the points, but you touched on that there are some support from the NHS. You touched on this point, so I would give you 2 in the management skills. Interpersonal skills, I don't have any big problem with the interpersonal skills. You were reflecting, you were trying to make me understand everything. So, yes, you can take yes, 1, 2, 3, 4, 5, 6, 7. 7. Okay.
It's generous of you. Thanks.
So 6 or 7 is at risk. Okay. If you are more than 8, you will be in the safe side. Sometimes 9. Sometimes it happened. 9. One of the doctors took 9 and didn't pass the station because the passing score at that station was 9.5. Okay. So it's based on the passing score in the station. I would give you take in the management, in the what else, in the consultation and time.
Okay.
Okay.
Okay. Okay. Thank you very much.
Thank you, Dr. Isra. So let's talk about the station quickly. Dementia, losing weight. This is a phone consultation. You are FY2 working in the neurology. Who is the patient? Mrs. Amanda Chapman, age 78, has been admitted to the hospital because of weight loss. She has been suffering from dementia in the last 3 years, and she has not been taking any food properly recently. All of the investigations, including blood tests, ECG, X-ray, ultrasound, CT, of the abdomen are normal. Okay, so they have given you everything. Patient has been given some fluids and she is able to tolerate a bit now. So she is a little bit fat. She can tolerate a bit of fluids. Okay, if she asked you, doctor, can I take her home? You can tell her, okay, she is tolerating now fluids and everything is normal. I can consult my senior if she is fit to go home, so you can take her home. But I am concerned about, going home with you alone, because looking after dementia patient is quite challenging. So let's talk about how can we support you or how can we help you in this. All right. Additional information. It has been decided that invasive and aggressive management is not appropriate. Palliative care has been decided by the consultant. So you will tell the patient, this is the management. She was very weak on admission, but she has been medically managed. So she is medically managed and fit. Your task, please call her daughter, explain her mother's condition, okay, discuss about further plan of management and address her concerns. Okay, so you will explain the condition, talk about the further plan, which is the palliative care. patient is not available to talk. Consent was taken from the patient, so you can talk to the relative. The weight loss is only due to dementia. Closed. Nothing else. You don't need to ask anything. You don't need to do any differential diagnosis. Okay? So what is your data gathering in this station? To be honest, only psychosocial. Only psychosocial. How much do you know? Recapping and psychosocial part. Even you don't need to ask about medical conditions and medications and allergies and these things. It is not the issue in this station. Okay? So, just 2 points. Recapping and psychosocial. Okay? If the relative tell you any concerns, any new symptom, you can explore it. But here, she didn't give you anything new. Alright? Okay. So what is the psychosocial? You can divide it by in two categories: the patient herself and the daughter, the relative. Who does she live with? What she can do for herself, her mood, is she able to sleep, eat well? Are there any carers involved? Wishes, you can bring it in the management. When she tells you, doctor, can you give her any artificial feeding or any kind of nasogastric tube? You will tell her, unfortunately, we can't give her anything aggressive. I just need to make sure to confirm with you. Is she having any kind of advance directive regarding her future treatment? So you can bring this here in the management. Okay. Then the daughter herself. How is your mood? Are you managing financially? Do you need any help? Any kind of help? So this is part of building rapport and data gathering. Okay? Do you have any other concerns regarding your mom? If she is concerned, you can ask her why and address her concerns. Alright? Here, you don't need to examine. You don't need to investigate. Everything is done. So you will tell her, okay, we have examined your mom, we have done all of the investigations, and thankfully all of the investigations, or the good thing that all of the investigations came back normal. She will tell you, doctor, normal, so why she is losing weight then? So you will try to tell her the dementia. It is because of the dementia. How much do you know about dementia? And explain the dementia for her. Dr. Isra has explained the dementia very, very well, but you took very long time to explain everything. So just 2 sentences and move on. Alright? Tell her it is, you can, dementia is progressive. Yes, it is. It can affect the memory and the concentration in the beginning, but at the end, as it is progressive, it can lead to impairment of many functions of the brain. The patient at the late stages can forget eating, and that's why she is not eating well, and also she is losing weight. Am I clear so far, Sarah? Yes, doctor. Okay. So she will tell you, doctor, so what are you going to do for her? Bring the palliative care right away. Don't try to tell her we have decided not to give her any aggressive, any blah 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 blah. This, you can talk about the aggressive treatment and these things if she asks you about this. Okay? So the plan is palliative care. Tell her, okay, so the consultant thinks that the best thing or the best treatment in her best interest is putting her on something called palliative care. Have you heard about this before? No, doctor, what is palliative care? Then explain the palliative care. It's a kind of holistic care for the patients when they are in terminally ill or in the progressive stages of their illness. We look after their mouth, their skin, their joints. We make sure that they are comfortable, okay, as much as we can. Am I clear so far, Sarah? She will tell you, doctor, oh, is she terminal, doctor? Is she dying? Will she die, doctor? So you can tell her at that time, I can see how you are concerned about your mother, and this is a really difficult situation, and also this is a difficult question to answer now, Sarah. We try our best to make her as comfortable as we can, and we make sure that she is comfortable, and let's talk about how can we help her and how can we support you, Sarah. Okay? So this is the answer of that question. She will tell you, doctor, can you give her nasogastric tube or artificial feeding? Tell her, unfortunately, we can't give her any aggressive treatment. Nasogastric tube is one of the aggressive treatment. It can put her in stress, and we don't want that to happen for her, Sarah. Alright? Yes, doctor. So, can I take her home, doctor? Tell her, okay, she's medically fit from what I have seen in the notes. Let me consult my senior, okay, and if she is fit, you can take her. But my concern is that you are alone and you need support. So let's talk about the NHS support for dementia patients and their families. Okay, then you can tell her, we can provide her with carers, we can also transfer to a care home, we can support you financially, we can support you psychologically as well. So which one do you think suits you the most, Sarah? Okay, and based then on her concern, you can talk about. Okay, if she asked you, doctor, so how can I feed her? You can tell her you can use something called comfort feeding, like giving her the fluid, the food in a liquid form, puree. Try to give her or remind her by swallowing every now and then, being with her, treating her like a child. I know it is a little bit challenging, that's why we need to support you, and I can give you leaflets about this. What do you think? Okay, then check with her the agreement. So do you agree, or do you have any other concerns, any questions? Okay, so this is regarding this station. So please, doctors, read your question carefully, think logically, know if it's a phone consultation, if it's face-to-face consultation, is the examination done or not, is been done or not, how are you going to verbalize the information in the question. Please, doctors. Okay, so this is the last slide in our session today. Thank you so much for listening, thank you so much for attending. I hope it was helpful and useful as well, doctors, and I hope it cleared some of the misunderstanding and some of the confusing points in your mind. So let's take your questions quickly, because I have to go at 12 o'clock inshallah.